Hello and welcome back to Who is a Medic Anyway, Australia's #1 anatomy-based game show. Today our lovely contestants Kayla, Chloe and Sophie will battle it out to prove that they are the expert on rheumatoid arthritis, a disease that affects the daily lives of more than 400,000 people here in Australia.
Rheumatoid arthritis is an autoimmune disorder essentially caused by the production of inflammatory cells called autoantibodies, which directly target and infiltrate the synovial membrane and synovial fluid found in joints, causing hyperplasia, synovitis, and increased vascularity. Further progression of the disease causes destruction of the cartilage matrix within the joints, more specifically resulting in erosion of the articular cartilage and the subchondral epiphysis of the adjacent bone. If left untreated, rheumatoid arthritis may also result in more systemic inflammatory effects, resulting in disorders of the cardiovascular, skeletal, and pulmonary systems. Morphologically, rheumatoid arthritis is characterized by immunomorphological changes involving infiltration of inflammatory cells, causing enzymatic lysis in the cartilage matrix, phagocytosis of the synovial fluid, and impairment of the synovial sheath to produce synovial fluid. Pannus formation, granular proliferation, synovitis, and finally joint deformity are also characteristic of rheumatoid arthritis.
Rheumatoid arthritis primarily presents itself as symmetrical, painful inflammation, stiffness, functional impairment and deformity in particular joint systems. The joints most commonly affected in the upper limbs include the proximal interphalangeal and metacarpophalangeal joints of the hands, and the radiocarpal, midcarpal, and distal.
To answer your question, the preferred radiograph that medical professionals would have it as would be plain radiograph, and the sensitivity would also be known as radiopaque. The high sensitivity is used to detect early onset of diseases that could be established in the patient, but detecting where it is in the radiograph, professionals have an advantage to monitor it over time. The radiograph can express indication of the soft tissue swelling, joint effusion, which has synovial fluid, and joint narrowing to be visible. Radiographs are the most cost-effective and less sensitive when it comes to early changes and showing the first signs of diseases in patients. If such instances where there could
As mentioned previously, imaging studies such as X-ray usually reveal the physical consequences of rheumatoid arthritis. In this example, we can see decreased bone density around the affected metacarpophalangeal joints, soft tissue swelling, narrowing of the joint space, and bony erosions. Here is another example of a patient's elbow affected with rheumatoid arthritis. And what you notice first is that there is marked joint space narrowing. That is, uniformed joint space narrowing and obvious cartilage loss. This appearance of uniform joint space loss is very common in this disease, and one that is easy for clinicians to identify.